Hey guys, this is Dr. Hub. Today we'll see the differences, and this is going to be a difference between the direct as well as the indirect. It's going to be direct and indirect ophthalmoscopy. So to begin with, first we are starting with the direct. So in terms of direct, the conducting lens is not required. So the conducting lens is not required. And what about the examination distance? So if we look at the distance of the examination, it is as close to the patient's eye as possible. So it is as close, or you can write as close to the patient's eye. And next, when we look at image, the image is virtual as well as erect. Magnification is about 15 times. Then comes the illumination. Illumination will be not so bright. It is not so bright and it is not so useful in hazy media. So not useful in hazy media. Then comes the area of field. So there is a concept of area of field in focus. So this area of field in focus. So this is going to be about 2 disc diameter. It's going to be 2 disc diameter. And looking at stereopsis is completely absent. Then looking at the accessible fundus view. So accessible fundus view. So here it is slightly beyond the equator. It is slightly and it is beyond the equator. Then comes the examination. This is going to be through a hazy media. And it is not possible. Examination through a hazy media, it is not possible. So similar way we are going to see the indirect ophthalmoscope. So in terms of the indirect ophthalmoscope, so here what's happening is the conducting lens, it is required. Conducting lens is required. Next comes the examination distance. The examination distance is at an arm's length. It is at arm's length. Next comes the image. The image in case of the indirect ophthalmoscope, it appears real as well as it is inverted. So what is the magnification in case of indirect ophthalmoscope? The magnification, if you see, it is 4 to 5 times. Then what about the illumination? The illumination, it is bright as well as it is so useful in the AC media. It is useful in the hazy media. Next is we look at the area of field in focus. So what will be the area in field of focus? Area in the field of focus. So this includes about 8 disc diameter. So in terms of direct it was 2, here it is going to be 8. Then comes the concept of the stereopsis. So stereopsis is present in case of the indirect ophthalmoscope, whereas in direct ophthalmoscope it was absent. And next we see the accessible fundus view. So what happens in case of accessible fundus view? So here it is up to the ora serrata. So it is up to ora serrata. Then when you look at the examination, and this is going to be through the hazy media. So examination through the hazy media, this is possible. So these were the differences between the direct and the indirect ophthalmoscope. Learn and grow daily. Please do subscribe.